Good morning. I'm asked many times by patients that how to explain the endometriosis in the easiest possible way. So I thought possibly I should do the same thing what I do in my clinic. And the easy way to put it is that we can divide the abdomen into two major parts to understand the anatomy. One is if we take the belly button in the middle, then the upper part has the stomach and then goes into the bowel. It has liver, it has gallbladder underneath, pancreas somewhere down here as well, and then some part of it is bowel as well. In the lower part of the pelvis or abdomen, we have a uterus, which comes into cervix and opens into vagina. And both sides, we have fallopian tubes on both sides, and ovaries are attached with this structure as well. Now that's just like a normal thing. And then around the uterus, we have the large bowel, which runs across and in like T-shape, and the rest of the middle is just all in the bowel as well. So that's a very normal structure I'm making now. Now, endometriosis basically means that this is the lining of the womb inside the uterus, which bleeds every month as a period. And the same lining of the womb start to grow outside the uterus in different areas. Or if we make a different way to put it is that if we have this is the normal uterus and cervix, vagina, uterus, fallopian tube on both sides growing and ovaries attached to it, then basically we have the endometrium lining inside the uterus. This endometrium lining start to become thick and thin every month. So when you start to bleed, your hormones are very low at the baseline. And if we say day 1, 2, 3, 4, 5, 6, 7, it goes into period now, the hormones start to go up and they reach their peak at the time of ovulation. And after ovulation, the hormones start to drop and they come down and we start to have another period. And this thing goes on. When the hormones are going up in this first part of your cycle before the ovulation, then these hormones work into the uterus and they make the lining of the womb thick and fluffier. Now, let's try to think again for endometriosis. There are many, many reasons from immunological, genetic, inflammatory. There are different theories about it. There's a similar endometrial gland at the lining of the womb start to grow outside the uterus as well in the pelvis, where you know what's outside is the bowel, is the bladder, all the structures now. So when the hormones go up and the lining of the womb start to become thick and fluffier, this lining of the womb also start to become thick and fluffier. Now, when the hormones drop, this lining breaks down and comes out as a period or blood. Now, same time, at similar time, this lining, because same hormone is effective for this one as well. So this lining also start to become thick and fluffier. As we have a period, this lining also breaks down and has a blood. But this blood has nowhere to get out of the body. So what happened to this blood? This turns into glue. So this blood, which is trapped inside, cannot get out of the body, is turns into glue. And this glue is the one which we call in our language endometriosis, or scarring and all those things. Now, then the next thing's concept comes that what does it mean to make the endometriosis attach all the structures? So I will just explain that in a similar way as well. And that will be that if you have now, if we think about a uterus now, let's make it as a uterus. Let's make it bigger now. And let's make it a uterus, and uterus comes like this, and uterus I will make it quite a large one so you understand, and uterus then ends up into a cervix. I'm making a different way the same thing as well. So this is a uterus now, and this is a cervix, and this opens up into the vagina here. Now, in front of the uterus lies the bladder, and then this lies the bladder, and this also opens up out in the urethra. And then behind the uterus lies the rectum or the bowel. This is just like a structure we have. And this rectum then ends up into a back passage. And if I draw a line here, this line, we can call it in a simple term, pelvic floor as well. Now, this will explain you what do we mean by erectovaginal endometriosis, which involves the bowel. Now, you all remember from the last one we talked about that there's a lining of the womb inside the uterus. So this lining of the womb, if we just go back to the picture above, when you have a period, the similar lining of the womb start to grow outside. So what's behind it? So we have a rectum which is behind lying as well. So this lining of the womb now, as it starts to grow, it grows from the back of the uterus. That's the back of the uterus. We also call it torus of the uterus as well. This place also called pouch of Douglas as well. And from endometriosis start to grow from here and gradually goes toward the rectum. It involves the top of the rectum and all this area is created, and this starts to create adhesion and scarring between the rectum and the vagina. And this can be extremely painful because if we take ourselves to the side now, we already made a diagram of vagina here. So it means this endometriosis now is growing right on the back of the uterus, is attached to the rectum, and this called plaque of endometriosis, which can be extremely painful. Sometimes endometriosis can grow to the front as well toward the bladder, and that can be very painful, and grows toward the rectum. That can be very painful, and the same thing will give pain during intercourse, pain during periods. So this is the very simple way to explain that how endometriosis grows outside the uterus and involves various structure. Needless to say that on both sides of the uterus we have fallopian tubes, and on both sides, and then ovaries. And this endometriosis can get into the ovaries, and these ovaries start to grow and make very large masses, which again can be extremely painful. And when both ovaries grow with endometriosis in them, what we call endometriomas, then this turns into a kissing ovaries because they're stuck on the back of the uterus. So the important thing to remember that is that most of the pain symptoms come because of fibrosis, adherence, scarring, and all these things that involve the nerves as well. And you involve the nerves and structure involved, that will cause the pain. So again, we can see now that this is the if we make it smaller, let's make it smaller. So again, same thing will happen, that it will lead to fertility as well. If this outside structure is not normal, involving ovaries, tubes, rectum, bowel, then obviously it will affect the fertility as well in about 15% of the patients as well. This condition of endometriosis happens in about 15% of women where they will suffer with pelvic pain and period pains. I will obviously come back to you with newer concept that what does it mean to have a shave, disc, bowel resection, anastomosis in the next series. But I hope this helps you to understand what is endometriosis and how it grows outside. Thank you.